Okay. Good afternoon. My name is David Jordan. I'm the President and CEO of the United Methodist Health Ministry Fund. Thank you so much for joining today's webinar on the Kansas Child Care Assistance Program. Access to affordable, high-quality childcare is essential to the well-being of Kansas families, the strength of our workforce, and the long-term economic prosperity of our state. It allows parents to work, employers to have a dependable workforce, and children to receive the foundation of healthy development they need for lifelong learning. The Kansas Child Care Assistance Program is Kansas's biggest tool to help families offset the cost of care through child care assistance or subsidies. However, only 7.4% of eligible children are currently served by the program, and only 40% of the child care programs in Kansas accept subsidies. So over the last year, we have partnered with Governor Kelly's administration, providers, K-State, other groups to understand the program and to make recommendations. Today's webinar will examine Kansas's current child care assistance program, what we learned throughout our research focus groups, and recommendations for improving the system for both Kansas families and Kansas providers. We have two great speakers, Kelly Davidov, our strategic consultant who led this effort, and Jennifer Francois, a professor of practice at the School of Human Resources at K-State, who led the focus group research to understand parent and provider experiences. Followed by Kelly and Jennifer, we will hear reactions from two members of our steering committee, Patty Pascal, who is the executive director of Kansas Child Care Training Opportunities, CASITO, and Rochelle Copland, director of Kids Zone KC. Before we get started, we do want to acknowledge that child care subsidies have made the federal news recently, with the Trump administration freezing funds for child care assistance in a handful of states after concerns about the program were raised in Minnesota. With the current conversation, while the current actions are not directly impacting Kansas, it is important to note that we need to maintain the integrity of the program and prevent any waste and abuse, making it tougher for children and families to access the program and for providers to participate will negatively impact the sector and the economy. We are excited for today's conversation because it represents months of hard work and common sense solutions to improve our childcare system. Now, some just quick housekeeping items before we begin. Given the number of folks on the call, your lines are muted. However, we hope you use the chat function throughout to engage in the webinar. If you could take a moment right now to introduce yourself in the chat, it'd be great to let folks know who's on the call. And please ask questions in the chat throughout the webinar. We will be monitoring the chat throughout and then take questions and answers after the presentation and panel discussion from our reactors. We look forward to a robust discussion and ongoing partnership to improve this much needed system that helps families afford childcare in Kansas. With that, I'll turn things over to Kelly to get started. Kelly, thanks so much.
Thank you. Hello and welcome. I'm Kelly Davidov. I'm an independent consultant working with the health team and have had the honor and privilege to lead and support this effort over the last several months. I'd like to actually just start by quickly walking through our agenda for today. We will begin by taking a look at the Kansas Child Care Assistance Program, including key data and an overview of how we approach this work. And then I'm going to turn things over after that to my colleagues at Kansas State University to review what we learned from families and childcare providers about their day-to-day experiences with childcare assistance. And we'll finish by sharing the recommendations we've developed to help strengthen the program and then move into time for questions and discussion at the end. So let's take a look at the Kansas Child Care Assistance Program. Before we dive in, I want to take just a moment to set the stage again for why this is so important. As David shared, access to affordable, high-quality childcare is necessary for young children and their families and for our economy overall. And in Kansas, as he said, the most powerful tool we have to improve access to childcare is the Child Care Assistance Program. Now, this slide provides a high-level overview of how the program works in Kansas today. Essentially, families apply for child care subsidy. They submit required documentation. They have to select a child care provider that is enrolled in the program and willing to accept subsidy. And then once the family is approved, they receive the funds on an electronic benefit transfer or EBT card that they can use to pay their child care provider. Over the last several years, Kansas has done a lot to strengthen this program, particularly by expanding family income eligibility and increasing child care provider reimbursement rates. Yet, as you'll see, participation rates for both families and child care providers remain low, and this is what we are hoping to improve. So let's zoom in on a few key data points that help us understand family access to childcare subsidy. In 2020, Kansas served just 7.4% of potentially eligible children in our state based on federal income guidelines. For comparison, the national average is about 9.5%, and some states serve as high as 15%. We also looked at key data about the process of applying for childcare subsidy for families. And last year, in our state, 42% of all applications were pended, which means that the family's application was missing some key information or documentation. Of the applications that were pended, 72% were ultimately denied, with the most common reasons for denial having to do with failure to provide requested information. And then lastly, as I mentioned, Kansas has implemented increases to the family income eligibility thresholds for the program, moving from 185% of the federal poverty level to 85% of the state median income over the last few years. What we've seen over time, though, is a steady increase in the percent of families participating that have incomes between 185% of the federal poverty level and 85% of state median income, meaning that as eligibility has expanded, the percentage of participating families with higher incomes has also increased. Now, as you've seen, family access to childcare subsidy is really important, and it's definitely something we want to increase. But equally important is childcare provider participation. Because if providers aren't willing to participate in the program, it makes it even more difficult for parents to find childcare and to use their subsidy. In 2024, only 40% of licensed childcare providers in Kansas were enrolled in the program and willing to accept subsidy. This participation rate has been holding steady since 2018. The year before that, participation dropped by 28% after a significant number of childcare programs were unenrolled from the Child Care Assistance Program for not meeting the requirements of the 2016 CCDF final rule. We wanted to hear directly from childcare providers about what might actually increase the likelihood that they would agree to participate in the Child Care Assistance Program. And in 2024, my colleagues at Kansas State asked them directly through a survey, and you'll be able to find the survey on the Health Fund's website, and it's also included in our final report that we're releasing today. But notably, 71% of childcare providers that responded indicated that direct-to-provider payments would be a factor in their decision. And as I mentioned previously, in Kansas, we pay families who then pay childcare providers. So we're going to hear more about what childcare providers and families have to say in just a moment. But first, I want to share a little bit about our approach to this work and to the recommendations we're presenting today. Our approach is grounded and based in the idea of centering the voices of families and childcare providers, both those with direct experience of the Child Care Assistance Program and those that have never participated. And we did that through a series of focus groups. We also engaged input and feedback from a pretty incredible group of Kansas early childhood system leaders and partners, referred to as our steering committee. And they represent childcare providers, nonprofit organizations, state administrators, philanthropy, and research partners. This group did the heavy lifting of reviewing data, listening to feedback from families and childcare providers, asking tough questions, thoughtfully considering different policy options, and formulating a thorough set of recommendations for improvement. And supporting their work was a smaller group behind the scenes that we refer to as our core group, made up of an incredible group of program experts, philanthropic partners, and research professionals who really worked diligently to gather data, coordinate logistics, and conduct our focus groups. We actually began our work on this project in June of 2025, starting with a grounding in the Child Care Assistance Program and how it works. And we worked through the summer months to gather data, learn from other states, and really engage in meaningful dialogue about how we could improve the program. Then last fall, we were able to review our focus group findings and begin formulating specific recommendations for change with our final meeting wrapping up in October. Now, hopefully, we have set the stage for you for what it is we're trying to improve and our approach to this work. And with that, I would love to hand things over to my colleague, Dr. Jennifer Francois of Kansas State University, to present the focus group findings.
Thank you, Kelly. Hello, everyone. As Kelly mentioned, and David, my name is Jennifer Francois, and I am with Kansas State University. And I and my graduate student and doctoral candidate, Sheetal Chudhari, worked on this project, and we were here to support by collecting and conducting focus groups with targeted populations of subsidy users, specifically child care administrators and families, both of those who use the subsidy system and those who don't. The focus groups really offered us an opportunity to collect in-depth information around attitudes, beliefs, perceptions, and opinions about the Child Care Assistance Program from those individuals who are users or potential users of the system. We had an overwhelming response with a little over 200 individuals who indicated that they would like to participate in these focus groups. Of those individuals who expressed interest, 75 were identified to participate, and of those 75, 50 completed the process. These individuals represented communities across the state of Kansas. And the following slides that I'm going to be talking about were what we learned from these focus groups. Slides are broken out into information by theme from child care administrators and information learned from families. And then the final slide is a set of recommendations from both groups that they identified as possible solutions to some of the things that they had discussed in the focus groups. Child care administrators were asked a series of questions about the subsidy program specific to things like enrollment, administrative tasks, financial management and payment, and communication with DCF. For non-subsidy participants, they were asked similar questions, as well as some questions specific to what prevented them from participating and their knowledge about and awareness of the program. As I said earlier, these slides represent themes that emerged from this discussion. Administrative and technology burden, communication, and payment processes were all topics that were frequently mentioned and discussed. Child care administrators spoke about barriers and challenges, specifically that they believed the process was complicated and that the outdated systems made it difficult to navigate and find information. They talked about difficulty with communication, specifically speaking about long wait times and inconsistent communication. Financial stability was also discussed. Administrators talked about experiencing payment and reimbursement delays that impacted their program financially. When asked about exploring alternative payment methods, administrators overwhelmingly had a positive response to direct provided payments and presumptive eligibility. Child care administrators also spoke about the perception of DCF. More specifically, this was tied to the belief that, or the perception that DCF is a program that quote unquote removes children from families. They felt that this might be a barrier for program participation and for family participation in the program. In terms of awareness, non-subsidy users stated that they knew little about the program. Some indicated they had no knowledge of the program. Others talked about how they didn't have a need to enroll families who receive subsidy because they were already filled with private pay families. For administrators who continued to participate, it was very clear that they do it for the families and the children in their care. And this was a very clear and consistent theme throughout our discussion with childcare administrators. Moving on to families. Families were asked similar questions, as well as questions about availability of care, specifically to programs who accept childcare assistance. Families also spoke about challenges and barriers to the online system. They called it frustrating and difficult. They described their interactions with subsidy staff as mixed, some speaking to incredibly positive experiences, while others spoke more about negative interactions. Families indicated that they would prefer to have a consistent point of contact and wanted to know more about how eligibility was determined. Families were incredibly grateful that the subsidy program existed, and this was again, a common theme that we heard throughout our discussion with families, and it was mentioned often. They recognized that without this support, it would be very difficult for them to work or for them to go to school. They did talk about how they wished more support was available because they did speak about how the high cost of quality care and how it would be wonderful to have more assistance to be able to pay for that. Families talked about challenges in finding childcare programs that accepted childcare assistance. This was particularly salient for families in rural areas. And like administrators, families also talked about confusion about the process for eligibility. And when they inquired about things, they received inconsistent information. When asked about alternative payment and eligibility options, families responded positively to presumptive eligibility, but were less enthusiastic about direct to provider payments. Trust and stigma responses were centered around families feeling shame and embarrassment, and that discouraged them from applying. And like administrators, families who are not using the subsidy program reported that they were unaware, or if they did want to learn about it, they actually sought out that information from other sources outside of DCF. And finally, this slide talks about a summary of the recommendations from the folks that we talked to. The most frequently discussed recommendation from both administrators and families was around better communication, specifically around more clearly articulated and identified places to find information and upgraded technology. They also spoke about reducing wait times, more outreach to rural areas, and a desire to increase eligibility to cover more families to seek out care. Thank you.
All right. Thank you, Jennifer. So I'm going to take a few moments of our time then to walk us through the recommendations that were developed by the Child Care Subsidy Steering Committee that I mentioned. And I want to offer a couple of thoughts before I dive in. First off, the group that put these together really did, as I mentioned, spend quite a bit of time reviewing the Child Care Assistance Program, all of the data that we could get our hands on, and most importantly, centering the feedback from childcare providers directly and from families. And so the recommendations that you'll see are grouped according to recommendations to improve the process for families and then recommendations to increase participation for childcare providers. I will also preface my comments by saying that I'm going to share the high-level recommendations with you, but each of these have a series of supporting strategies and action steps that correspond to the high-level recommendation. And so after our discussion today, I really highly encourage you to take a comprehensive look at the full set of recommendations and spend a little bit of time diving in deeper. So with that, I'm going to start actually walking through the recommendations that we are delighted to put forward for improving family access to childcare subsidy. The first recommendation is to develop and implement a presumptive eligibility policy for Kansas families seeking child care subsidy. And if you recall, this was broadly supported in the focus groups by both families and child care providers. We also want to recommend that our system assess current and available technology platforms to identify how they could improve and simplify the application process for families, and also to develop or leverage existing navigator models to help families with the subsidy application process and know and understand everything that's required of them. We are also recommending that the program review all communication touch points with families, everything, written, digital, how we communicate over the phone, what information we provide, to identify opportunities to improve clarity, frequency, and consistency. We also recommend assessing, addressing, and investing in program infrastructure and staffing to ensure that the program is able to meet the needs of families, and so that they're able to get all of their questions answered and to smoothly get through the application process. We also recommend addressing legislative barriers to participation, including looking at requirements to cooperate with child support services and other employment-related requirements. And then we recommend leveraging user testing data and feedback from families on an ongoing basis to support continuous quality improvement as we move forward with improvements. Shifting gears a little bit to talk about the strategies we're recommending to improve childcare provider participation in subsidy. Perhaps not surprisingly, we recommend implementing direct-to-provider payment practices. Also assessing current and available technology platforms to identify how they could improve and simplify the subsidy enrollment and management process for childcare providers. Developing and leveraging existing peer navigation or coaching models for providers, just like for families, to assist with the subsidy enrollment and management process overall. And then we recommend leveraging the newly created Child Care Ombudsman position within the Kansas Office of Early Childhood to review and address any payment discrepancies or overpayments that providers may encounter. We recommend reviewing all communication touch points with providers as well, just as with families, taking a look at written, digital, phone communication, and working towards improved clarity, frequency, consistency, and tone overall. And we recommend assessing, addressing, investing in program infrastructure and staffing needs to help with the provider side of things as well, and making sure that they have all of their needs met. The last recommendations I want to share with you are to develop and implement an outreach strategy to engage the 60% of licensed childcare providers in Kansas that do not currently participate in the Child Care Assistance Program, with perhaps exploring additional financial incentives that might increase provider participation. And again, leveraging user testing data and ongoing feedback from childcare providers to support continuous quality improvement. So, looking at like the path forward in our next steps, Kansas stands at a really important moment of possibility, and our collaborative work with this project shows what's achievable when we bring policy, data, lived experience, and shared purpose all together. Yet moving from recommendations to action will require intentional coordination and clear accountability, strategic collaboration. However, there are concrete, actionable steps we can take now, right now, even in the midst of change. And together, we can double down on our commitment both to listening to families and childcare providers and to transparency as we move forward. So, with that, I will turn things back over to David.
Excellent. Thank you, Kelly and Jennifer. Um, as I turn things over to Patty and then Rochelle for their reactions, I do think that we want to recognize how important collaboration is to implementing any next steps. We know that this may take time, and many of these changes can be implemented at the administrative level, could be adopted as the Office of Early Childhood is launched, and then some of these changes would require legislative action. We did take a deep dive into all of these things, and as Kelly noted, all of these recommendations were grounded in feedback from providers, families, and input from stakeholders. So we're hopeful that we will see action as we implement these. Most importantly, we wanted to take a few minutes to hear from some of our steering committee members to react to these recommendations. First, I'll turn things over to Patty to share her reflections, and then we'll turn things over to Rochelle, and then I'll get to questions in the chat and direct them to different folks. So, Patty, I'll turn things over to you.
Perfect. Thanks, David. First, I want to start by just expressing my appreciation to the United Methodist Health Ministry Fund for convening and leading this work, and particularly to Kelly Davidoff, working with the team with Jennifer Francois and her work as well for grounding it so clearly in data. I'm very impressed with this report. It really does take a data-informed look at how the child care assistance program is functioning today, while also being proactive about how we can do better as a state. I think it does thoughtfully balance a data analyst with a genuine understanding of how policy decisions play out for families and for our early childhood programs that are out in the field across the state of Kansas. So with that, also want to acknowledge the role of the Department for Children and Families. The DCF staff support both families and providers who are working diligently on behalf of the state. And our team at Casito here, we have consistently experienced strong partnership and commitment from DCF. And as this work moves forward, it's critical to recognize, as we looked at as part of the recommendations, that system change requires adequate staffing and capacity. I think human interaction is central to making these programs function, and we have found that in our work as well, of course. As a member of the Child Care Subsidy Steering Committee, this process reinforced for me just how critical it is that we continuously examine systems through both numbers and lived experiences. When I look at the report, I see the identified challenges, not as failures, but more so as opportunities for us, opportunities to reach more families and to help be a part of strengthening provider participation and to ensure that the child care assistance program is truly supporting access to stable quality care. So I think what this means for our work here from the perspective of Kansas Child Care Training Opportunities, this work has real potential implications about how we continue to support the licensed child care programs across the state of Kansas. We have a team across the state of Kansas that provides professional development, training, and technical assistance, and is in daily contact with licensed providers in communities across the state. And so I think because of that, we really sit at a unique intersection between policy and practice. And I think this report gives us an opportunity to be more intentional about how we support programs in understanding and navigating child care assistance. From encouraging participation in the subsidy program to strengthening business practices that support families who rely on care. I think it also challenges us to think about our professional development specialists for us who are positioned statewide, and how can they be better equipped with data and context to support the providers in accepting subsidy and addressing barriers in practical and realistic ways. And I think equally important, it reinforces the need for strong feedback loops. I think, as Jennifer talked about the focus groups, our licensed childcare workforce must have a mechanism to share what is working, where the barriers exist, and how to implement efforts that are impacting them in real time. Their voice is essential to continuous quality improvement. So, overall, I think this work reflects a shared commitment to doing better for Kansas families and children, and acknowledges that the early childhood professionals in the licensed settings across the state of Kansas, that they are a critical component for success. We continue to listen, adapt, and work together. I believe these strategies can lead to meaningful, lasting improvements across our early childhood system. So thank you for letting me have some time to talk about this.
Excellent. Thank you so much, Patty. And I'd like to turn things over to Rochelle, the Director of Kids Zone KC.
Hi, David. Thank you. My name's Rochelle Copeland, and first and foremost, I would love to thank Governor Kelly and her office for the opportunity for even the steering committee. I would like to thank the steering committee and Kelly for leading the steering committee with such great class. Actually hearing our thoughts and hearing the things that we were saying, especially for me as a director, to Jennifer and K-State. I also want to thank you and to Hope United Methodist Health Ministry Fund. Thank you. First and foremost, as a director, this has been very eye-opening. One, to see on the back end that the DCF is trying to make changes. However, my experience, I have 80% of my families are on subsidy. So subsidy DCF is a big part of my everyday work here at Kids Zone. I'm trying to help families maneuver, get on funding, get subsidy, the wait, between the wait and things like that. It can be challenging for families. So I'm excited about hearing one, the exploring the option of making the process easier. Because a lot of families, not all families have the same level of education. And so some families, it is very frustrating for them to try to get enrolled. And if they have to go over the phone, it's a long wait period. Or if they have to go in person, they're having to get there super early to get in line because the line and the wait is long. Or trying to get their application responded to. So first and foremost, them trying to simplify that application would be very helpful for us as directors and getting families to be able to get enrolled quicker with the process. Secondly, as a director, I have a lot of times when families, the wait time is pretty hard. So them between starting a job and being able to actually get into childcare sometimes becomes an issue due to the fact a lot of times they have to have a job already lined up before they will give them childcare, or a childcare facility lined up before they will be able to give them assistance with care. With that, we can't enroll children until we know for sure that they're going to be able to pay their monthly payment. So trying to hold that spot or work with that family to get funding can be a little bit challenging. So the process of the excuse me, presumptive, I'm so sorry, I don't know, I'm getting nervous, eligibility, that would be very beneficial due to the fact it would help us be able to enroll the child and then try to figure things out along the process of them already being able to enroll, that parent being able to go to work, and that child having a safe place to be cared for while the parent is at work, until we can figure out all the ends and the details of them being able to figure out if they're going to be eligible or not. Secondly, providing payments directly to child cares will be absolutely helpful due to the fact a lot of times payments are like right now in the days the 8th, and we're still trying to get payments from some families. It will be easier to keep families enrolled, not having to have those challenging conversations with families about making payments if we were able to just receive the payment and the child's already in good standing to be at school day in and day out, starting from the first of the month. So those are some of the concerns that I had as a director of application processes or renewing the application process. I have about 5 families right now who are struggling with renewing and trying to get their funding to be able to come back to child care. That is a major issue. Another major issue is receiving funding from parents on time, and then also being able to enroll children in advance due to the fact that parents are looking for care and needing care immediately. So those are the 3 things that was huge for me as a director to see if we can, because a lot of times I can't help parents. I can't help them if I don't know what's going on, or I don't have access to see where they are in the application, or if there's not a contact number for me to directly call to say, hey, I'm a provider. Trying to look into so-and-so's application to see what's going on. So when you can't help them, you kind of feel helpless. But you want to, as a provider, I want to make sure that families are able to receive what they need. So having the access to help families do an application, having receiving payments on time as a provider is helpful. And then also putting in a process of maybe setting up something to where we can help families in need first before having to wait 3 months to figure out they're going to be eligible or not would be greatly appreciative. Thank you for the time. And I've absolutely enjoyed being a part of the steering committee. And I've learned a lot. And I appreciate you guys taking into consideration everything that we've said, some of the frustrations, but then also some of the pros. And so I'm super excited to look forward to seeing what we're going to do in Kansas for the future with DCF.
Excellent. Thank you so much, Rochelle. And I think having your experience and Patty's experience and the other providers' experience, it really was critical to helping shape some of these recommendations. We have some great questions in the chat. And if it's okay, I will probably direct some of these questions to Kelly first and then ask others to chime in. In terms of before I get to Jack's question about the denials, Yvette Walker had asked just how child care assistance interacts with the Affordable Care Act. Um, I think the important thing just to note on this front is that many of the same families that are looking for support through enhanced premium tax credits through the Affordable Care Act, or may be impacted down the road through Medicaid cuts, are the same families that are eligible for child care assistance. Um, so there is overlap. So as it becomes harder to enroll in programs or more unaffordable, it's just additional stress that are put on these families. But there's not necessarily a direct um, tie between enhanced premium tax credits and Medicaid and the child care subsidy program. Though I think a lot of the lessons learned from this report um, could also be applied to our other safety net programs, SNAP, TANF, Medicaid, to make it easier for families to enroll in this program, and to enroll in all of these programs that help reduce their stress and maximize development and health for families and children. Kelly, I would love to turn to you first in terms of Jack's question. I think really good, gets at just how technical in the weeds we got. But if you could talk a little bit about the pended applications, then maybe tie that to some of the recommendations, and we can go from there.
Yeah, so we spent a fair amount of time actually as a steering committee and even our smaller working group behind the scenes taking a look at denial data for family applications for Kansas Child Care Subsidy. And it's actually all included in one of the appendices of the report. So if you're very curious about that, you'll be able to go and see the breakdown by denial reasons. But yeah, we really considered that information in terms of what that might mean for families moving through the process. And as I mentioned, about 42% of all of the applications that came into the Child Care Assistance Program from families ended up being pended. And pended essentially means that there's some information missing, some additional verification required. And then when we looked at that breakdown, about 72% of those pended applications ended up being denied outright. And there were additional, families came back at some point, a certain percentage of them to reapply or to try to resubmit the verification that was requested from them. But it was really informative to look at the application denial data to help us understand where there might be opportunities to improve the process for families, and to think about whether and how to simplify things, how to support families up front in thinking about what they might need to submit with their application before they start the application process so that they're prepared, they can get it all submitted in one fell swoop, and to hopefully make it through the application process a little bit more smoothly. So I'll let others chime in if you'd like to add to that. Please do.
if anyone has any thoughts, please weigh in. If not, we can always come back to this a little bit later. But I do think some of these better communication, some of the things that have been mentioned in the chat will really help with denials time. And then I do think this is where technology and then outreach could be really helpful to deal with this. And then there is the tie, obviously, to presumptive eligibility. Yvette also had some good questions in the chat in terms of paying providers directly. And Yvette's question was, if funds go to providers instead of families, how would that work for families? So I think there's a lot of folks could probably chime in on this. Rochelle, you touched on it already, but um, our initial research like highlighted just the importance of um, provider participation and families accessing child care assistance. So if providers aren't participating, it becomes tougher for families to participate because there's no providers that can provide the services. So that's why we initially started with understanding providers' experience and then came to this process. So Kelly, if you could talk a little bit at first about the concept of paying providers directly and why that's important, and then Jennifer might be able to share some of the feedback. And then, of course, Rochelle and Patty can talk about on the ground experience, just about why this is an important piece to boosting participation.
Yeah, I'm happy to jump in and offer additional context to that. So, Kansas is one of 3 states that provides childcare subsidy funds to families through the EBT card. And it's done prospectively, meaning that the funds are available for families at the beginning of the month, and then families use the EBT card to pay their childcare provider based on whatever terms and payment conditions that childcare provider might have. So that's really up to the family and the childcare provider to determine. The vast majority of states, however, pay childcare providers directly. So the funds are not first, available to families, but they are actually sent directly from the state to the childcare provider. In both cases, the funds eventually are routed to the childcare provider. However, a lot of what we understand and have heard, and I won't steal Jennifer's thunder on this, is that direct to provider payments tend to help childcare providers in terms of more reliably collecting the payment and being able to predict their revenue a little bit more accurately. And so, Jennifer, I might just pause because I see you nodding and you've probably got a lot to jump in and add there. So I'll let you do that.
Thanks, Kelly, and thanks, David. Yes, I would just echo everything that you mentioned, and many of the comments that Rochelle spoke about related to direct to provider payments. When we spoke to administrators. As I said earlier, we spoke to administrators who are currently using the system, and then we spoke to administrators who are not using the system, but could use the system. And we asked very specific questions along with follow-up questions around this notion of direct to provider payments. And in those discussions, it was very clear from providers that they felt that this could increase participation. And in fact, when we followed up some of our discussion with some of the statistics that Kelly mentioned earlier about how many providers are currently participating in Kansas, providers were unaware and shocked, really, that there were so few providers that participated. For the providers who are currently participating, that they were just, I think they couldn't believe, like, because they were like, well, why wouldn't people participate in this? And then as we dug into that discussion, it became clear that there are some challenges around the financial aspect. And as Kelly just mentioned, that the direct provider payments could provide more stability for folks, which could incentivize providers who are not participating to participate. And so it was a really wonderful discussion because it not only did it talk about like provider participation, but it also kind of flowed into that financial aspect too. And I would also say this is also connected with some of the conversations that we had with families about access to care in specific areas. If there were providers that had that were accepting childcare assistance in areas. Oftentimes, slots were unavailable for children, and in some cases, in more rural areas, we heard from families that just talked about not having providers in general who accepted childcare assistance. And so I think, as Kelly indicated, those this idea of direct to provider payments could be a solution for several of the barriers that are currently existing. And Rochelle, I don't know if there's other things that you'd like to add as well to that.
No, you guys pretty much hit it on the head. One thing I would add is sometimes I would like prefer that to be given to the provider. Reasons being, one, it keeps from having to have that negative conversations with parents about payments. Two, some parents have issues with the online paying via online, and then if they have to call in, sometimes if you're not in a quiet space or you hit the wrong button, you have to start all over, and they'll say, I don't have time for that right now. I'll do it later. And so it takes time for that. Sometimes the amount is not correct that they put in due to the fact of having to push buttons or so it would be help us if I knew exactly up front what was paid. So I know this family has $1,727.10 coming in. I can then tell parents up front, hey, this is what you're going to owe each month, instead of having to figure out or wait till we get the payment or there's a mistake or they think they're getting one amount and they don't know for sure. We know exactly what each family is getting paid. So every month it's consistent, every what they'll be getting, instead of having ups and downs because they accidentally didn't pay enough and then they're trying to pay more. So this month they're paying less, but then they're wondering why they're paying more next month. It just creates consistency. It creates better relationship and just a lack of stress and no frustration due to the fact we both know what's getting paid. We both know it's getting paid, and we both knows what's getting paid, and it's just an easier process. Is why I would prefer to have providers being paid instead of letting the parent do it. And then if a parent's out or if something's happening, they may have to miss a week or two paying it or not thinking about it because their child's not here. Then there's late fees going out for that still. So just it's just consistency. Every month we know what's going to happen. Every month there's no surprises. And if there is a surprise, we already know in advance what's going to happen because we're communicating with the state.
Thanks, Rochelle. I mean, I do think that this really, both from Rochelle's comments and others, focus the qualitative and quantitative data showed that paying providers one of the biggest changes we could make to getting more child care providers participating in the program, and then eliminating that barrier for families to participate. And going back to Yvette's, tying it to Yvette, the first part of Yvette's question is in some ways paying providers directly would move us closer to the healthcare system. You know, we pay doctors, hospitals, FQHCs. The state Medicaid program directly pays those healthcare providers, and this would be putting childcare providers in the same vein as healthcare providers, where the state child care assistance program is paying them directly, just as Medicaid is paying healthcare providers directly. It's really a common sense recommendation that provides certainty to providers so that it makes it so they can do projections and have that financial base to participate in this program and make it possible for them to serve the families that are eligible. AJ had a good question, which I think it follows on well to this, which is what does outreach look like to the 60% of providers that are not participating today, and how it might help them participate? And maybe we could start with Kelly again, and maybe there's some lessons learned from other states to boost that participation and to share, and then for others to weigh in terms of personal perspectives and research.
Yeah, I'm happy to jump in and also welcome comments from my colleagues as well. Being able to reach out and engage the 60% of providers that are not currently participating in enrollment, I think is a really important recommendation. We have some solid strategies. outlined in terms of continuing to support new childcare providers as they're coming into the system and they're enrolling. We've thought about some ways to make that easier, and including things like having them opt out of childcare subsidy rather than having to opt in. Very simple changes like that can really help on the front end of the process. But this is a great question because we still have a very large swath of childcare providers across the state that are existing, they're operating, they're licensed, they're serving families and children, and they are not participating in the program. And so, even as we're looking at some of these more programmatic and policy shifts to increase the likelihood that they'll participate, I do think that there are some opportunities for not just the state of Kansas and our Department for Children and Families, but also our entire early childhood system in Kansas, all of the partners, Patty at Casito and Child Care of Kansas, and all of the nonprofits that are working with childcare providers directly to have more intentional, focused outreach. And so that the message is being delivered by the people that are already on the ground working with providers. They're sort of their trusted partner, their trusted support system, and being able to very intentionally and strategically integrate that message into all of the other services that we provide for our existing licensed childcare providers, is one way to approach that. There's, sort of broad communication strategies, but then there's also leveraging the relationships that our supportive partners have with providers in the state already. And some of the sort of sub steps or strategies on our recommendations also include things like embedding knowledge and education about the subsidy program in a lot of our other service contracts. So, even things like home visiting and, some of the other early childhood services so that we're reaching families and that group of childcare providers. But I think there are a lot of ways we can approach that. And I'd love to open it up to some of my colleagues too, to see what you think or what ideas and strategies you've got in your minds.
Yeah, Kelly, I would just echo that in saying, I think going back to what I had mentioned, that this is where I think it is so important that we have investment in the human connection. It's great to have all the technology and the automation of systems and whatnot, but really, as we're looking at trying to recruit those into the system that are not already in the system, there's been a lot of campaigns out about the importance and how it's a need, but really having that ability to have someone that is on the other side as we talk about the navigators, that they is a trusted source that they can work with one-on-one. And I think David, you were mentioning likening it to the healthcare system, and as we think about direct payments. When we do have those automated calls, we always know that the doctors, the healthcare, they always get a press one if, and they kind of get this direct line, and thinking about our providers in the same way, making sure that they have access to that someone that they can trust and that is going to be working with them for success.
Thanks, Patty. Did anyone else have anything to add? Jack had a really good final question, and I may tweak it a little bit. Other states that have moved towards building a universal child care system have really focused on improving the child care assistance program and then expanding it. So can folks talk about how important a child care assistance program, a well-functioning child care assistance program is to making childcare more affordable and really helping improve the entire system and addressing shortages. So I don't know if folks can offer some thoughts on that.
I'm happy to start again, but also don't want to steal the floor from my colleagues too. Let me offer just a few sort of high level thoughts. In Kansas, when we look at the availability of childcare, so our supply against the potential need, there's a pretty big gap, and we do need more childcare supply in Kansas. I think the intersection and the interplay and the importance of the child care assistance program is what that means for families who are relying on childcare subsidy, lower income families that rely on this support to be able to afford childcare while they're working and going to school. And when you have a state like Kansas, and I mean, we're not unique. This is childcare supply is an issue nationwide, but um, when there's low childcare supply and you don't have a lot of childcare providers willing to accept childcare subsidy, it compounds that effect for some of our more vulnerable families in Kansas, our lower income families that are really working hard, and they're trying to go to school and trying to advance their careers. And it we need to have a both and approach to this, and that's part of why the Child Care Assistance Program is so important. It really addresses access for lower income families, helps them maintain self-sufficiency, and having childcare providers participating and willing to accept subsidy is a benefit for everyone. It's a really important, revenue source for childcare providers. It also helps families access that, particularly in rural communities or in communities that have other disadvantages. And it's kind of a compounding and very interrelated question. So I'm not sure how well I address that. Jennifer, you might have some thoughts to add. I see your head nodding too, so I will toss that to you.
Well, I would just say in relation to what we heard in the focus groups, many of your comments, Kelly, are things that we heard from administrators. Administrators, and this was, a prevalent theme throughout the conversation with this group, is that they want to help support the families that they serve. And those who are participating in an assistance program recognize that that system is a support for the families. And I think that in thinking about some of the conversations we had with families about access to childcare, and recognizing from their perspective that they need this support in order to be able to do the things that you just mentioned. And knowing how crucial that support was echoed, throughout not just the administrators, but the families too. And like I said earlier, from the administrator's perspective, particularly those who are currently participating, that many, if not most of them, were just wondering why there weren't more people participating in this, because this could be a mechanism to support families as well as offer access to families who may not have access otherwise. And so they saw it as an incredibly valuable system to participate in. And so from both of those groups, families and administrators, they really see the Child Care Assistance Program as a way to be able to support families across the state, and want people to participate in it, and get more providers out there participating in it as well.
Excellent. Thank you, Jennifer. I know we're at time, but Rochelle or Patty, did you have anything you wanted to add?
I think they hit it on the nail again. I would just add, as a provider who does take subsidy, one of the questions that I'm always asked when parents call is, do you take state assistance or do you take DCF, before they would even entertain having a conversation with me. So it is a need. What a lot of families needing that. I would say one of the struggles, maybe why some people do not do state assistance, is one, not enough information on it. So all of the myths out there concerning around it, that they may have heard of the frustrations of dealing with it. If there was something that could be in place, whereas when someone becomes through a system where they become a licensed facility or a home daycare, that there is information immediately given to them to try to see if they can help them sign up for it, would help. We do have a lot of families in need in Kansas who are looking for childcare, and if only so many are doing state assistance, then there's a lot of families who are not being able to be helped out there. So it would be very helpful if there was something in place that made taking state assistance a little bit more advertisable, where advertisement to where, hey, let me look into this, see how I can help more families, that would be great. But also, by the time we're doing that, it needs to be something in place where DCF is just running a little bit more smoother for families to be able to do that as well. But yes, I think they hit on the nail. We can only take so many children, and it is a major need in Kansas City. Childcare is very much needed. We get calls every single day, and based upon if they have the support financially or not, is depending on if they're enrolling. I saw a lot of families go to the school district because it's free, and they wouldn't have to pay so much out of pocket. I saw a lot of families stop working because of the fact of the cost. Why they said by the time if they have more than one child, they have two or three children, if they can't get support from the state, then by the time their check comes around, they're paying their entire check to childcare. So we have children who need to be in educational settings at home due to the fact of financial obligation.
Excellent. Thank you so much, Rochelle. And thanks to everyone for joining us today. We really appreciated the discussion and you spending a few extra minutes with us. We know that access to high quality childcare is necessary for Kansas children and our economy to be able to thrive. And it's critically important for the working parents of young children to be able to find quality, affordable health care because it aids in child development and helps them return to the workforce. The recommendations that we shared today were grounded in feedback from families and providers, the experience from other states, and a collaborative process. And they will help us improve the best tool to help parents access that quality childcare, the Child Care Assistance Program. I really do want to thank the governor's office, Zach Vincent, Nikki Adams from DCF, the DCF team for their partnership in this project, as well as other members of the steering committee, KDHE, and then, of course, Kelly David Dove, Jennifer Francois, Sheetal Choudhury, and the team from the Health Fund, Jackie Biggs, Nancy McCready, uh, Jeff Gamber, that helped to make this project possible. Thank you all so much. And I look forward to working together with everybody on this call to strengthen the Kansas early childhood system and continuing to partner to ensure Kansas is the best place in the country to live and raise a family. So thank you so much for joining us and for the extra 4 minutes of your time. If there's anything we can do, please feel free to email us or call. We're here to help and follow up on this report. Look forward to working together and have a great day.